Another day has begun for Regina Kondwerani of Mdua village in Mchinji, about 100 kilometers west of Malawi's capital city, Lilongwe. She has to wake up early and perform the household chores, including drawing water from a shallow well close by her house before she goes to school. She explains how the day is like for her and her siblings.
Every morning we share household chores for the home. While one is sweeping in the house, one sweeps the surroundings and one is preparing the fire. When the fire is ready, we start by preparing porridge. After the porridge is ready, we warm water for bathing while we eat the porridge. We all bath and then go to school. If one of us gets home early from school, she prepares lunch so that when we all get back, lunch is ready. After lunch, we go to play. The routine is the same in the evening.
At 16, Regina is a figurative mother of 4, a responsibility that was actually forced on her by unfortunate circumstances. She is the eldest child in a family of 5, all girls. Their father died in 2003 and the mother decided to remarry in 2004. The new husband decided he did not want the children to come with the mother and she left them to fend for themselves.
After our father died, we moved from where we used to stay to live at this place. Before long, our mother remarried and went on to live with the husband in Robert village. We did not go to her husband's home village, but remained here.
Since then, Regina has assumed the role of a mother, providing for her 4 sisters and herself. Life has not been easy, especially to feed the siblings and ensure that they all go to school.
Since our mother left us, we do everything on our own, be it going to the hospital, working on the farm. We all do it by ourselves.
Fortunately for Regina, she is a beneficiary of a scheme being piloted in her home area called the Social Cash Transfer Scheme.
The scheme is based on an analysis of poverty in Malawi. Malawi has 52% of all their people living under the so-called poverty line. These are households, and some of them are poorer than others, and some of them have different household structures. 52% under the poverty line, 22% under the ultra-poverty line. And ultra-poverty is a terrible state. These households live on 1 meal per day. They cannot buy soap, they cannot buy clothes, they cannot fulfill any of their basic needs, and the households are full of children.
With the government of Malawi in the lead, the Social Cash Transfer Scheme began. It was coordinated by the Department of Poverty in close collaboration with the Ministry of Women and Child Development with support from UNICEF. Malta's government has different safety net programs aimed at cushioning the impact of poverty, especially among women and children. There is a group of people who cannot have access to these programs for different reasons. This is why the Social Cash Transfer Scheme is important to mitigate for such vulnerable groups.
It was important for government to come up with the social transfer because, as you know, Dr. Bingwa Mutharika's government puts a lot of emphasis on poverty mitigation measures. And whilst there are other government initiatives to deal with poverty, such as the public works and the like, it was realized that there are sectors within our community, some Malawians, who would not be able to take part in programs like public works because of other constraints that they have.
UNICEF supported the design of the methodology for a cash transfer scheme in Malawi. And our interest was really to see how can we help the children and tackle child poverty, and to really look at access barriers for children to access education, to access health, to access a proper diet, etc. So now we actually see that with the cash transfers, these access barriers are being overcome, and that it is a big investment in the children in households that were often left behind because the ultra-poor labor constraint were never really targeted by any other social protection intervention.
The scheme targets the ultra-poor and labor-constrained households. Jim Mchinji is a desk officer of the Mchinji Cash Transfer Pilot Scheme and has been at the center of the project and explains more.
When we say households which are ultra-poor, that means households which get maybe only 1 meal per day, or maybe the whole day without any meal, or households without any valuable asset. When we say valuable asset, that an asset that the household can sell and get money.
The National AIDS Commission is also another partner besides government and UNICEF. According to the Commission's Executive Director, Dr. Biswick Mari, the Commission is involved because the HIV/AIDS pandemic is not just a health problem.
Our main interest is to support orphans and other vulnerable children, and particularly also the elderly that are caring for the orphans, or they are supporting the orphans in one way or another. So we have a component in the national response to HIV. It's called impact mitigation. And so that's an area that we have an interest ourselves to look after the orphans, the chronically sick, as well as the elderly who are also supporting the orphans in this particular case.
In the cash transfer, a monthly disbursement of cash is paid to beneficiaries by the district assembly staff, accompanied by police at a safe and secure place. A household with one person gets $4 or 600 kwacha a month. A two-person household gets $7 or 1,000 kwacha. A three-person household gets $10 or 1,400 kwacha, while a household with more than 4 people gets 1,800 kwacha. For children enrolled in primary school, a bonus of $1.03 or 200 kwacha is added. For secondary school children, there's an additional $2.06 or 400 kwacha. The child bonus is designed to encourage school enrollment and attendance. Once the children grow up, educated and healthy, they have the potential of breaking the cycle of poverty that is usually passed from one generation to another. And this is true of Regina and her siblings. With the 2,600 kwacha that they receive per month, they have been able to meet some basic necessities.
We get 2,600 kwacha from the Social Cash Transfer Scheme. Our priorities every month are the basic household needs like salt, cooking oil, soap and school materials, and we also purchase whatever is needed at home. We eat 3 times a day. In the morning, we either take tea or porridge. At lunch, we have nsima, as well as at supper.
It is pleasing to know that Regina, who had dropped out of school in order to fend for herself and her sisters, is now back in school. Even the head teacher of the school she goes to has noted a great improvement both in attendance and school class performance.
Definitely, Regina has indeed improved. One, she's able to report for classes, and again, she is now putting on very good clothes, and again, she is able to mix freely with others. Previously, she was isolating herself due to poverty.
The head teacher, who is aware of the scheme, says the scheme has had a positive impact as some children who dropped out of school due to poverty are now coming back.
This program, Social Cash Transfer Scheme, has assisted us a lot in the sense that previously our enrollment, pupils' enrollment was low, but as of now it is around 1,018. And the attendance of pupils was not interesting because most of the poor pupils were unable to attend classes because of, say, shyness. Their clothes were in tatters. But with this social cash transfer scheme, buy clothes and of course writing school equipment.
With the little money, Regina and her sisters managed to buy the government-subsidized fertilizer and for the first time harvested enough maize to last them a year. They also bought a goat, which they are keeping and hoping it will give them some more income. Additionally, they have also saved some money, which they've used to hire labor to mold bricks, which they intend to use to build a new house for themselves.
With the money, we have been able to buy goats, kitchen utensils, school uniform, and used part of the money to hire labor to mold bricks for use as we want to build a new house.
It is no secret that the money that Regina and her sisters are getting is making a great difference in their lives. As children with no older person to look after them, life can be so tough. The money has actually saved them from being destitute.
Before we started receiving this money, we had many problems. We didn't have adequate food and clothes. Our school attendance was also very erratic because we did not have the resources, things like notebooks and clean clothes. With this scheme, we have experienced a great change. We now have uniforms, we have food. We are also able to go to school every day. We are much better now.
From our point of view, we are now seeing a child program in place, while others, of course, look at it from the social or monetary point of view. But we are looking at it's a child-related program because out of 14,000, 9,000 are children. And then you're talking of orphans, which this means, of course, with government partners as well and other development partners. We're looking at orphans, and orphans, we're talking of 7,000 of them. And there it gives us the courage that if this is the right approach, if this approach can be continued, we will now really support our children to grow, develop, and become productive citizens.
Regina is just an example of more than 9,000 ultra-poor children who have benefited from the scheme. Almost 8 out of every 10 beneficiary children have lost either one or both parents. And close to 7 out of every 10 beneficiaries of the scheme are children. With the planned expansion to 6 more districts of Salima, Machinga, Chitipa, Mangochi, Likoma and Palombe, the scheme will reach around 6,000 households, benefiting close to 40,000 children. It is therefore hoped that by 2015, the number of households on the scheme will be 250,000, benefiting close to 700,000 children. This is Rita Nelisoni, 34, from Wincholonjo village, Traditional Authority Mdua in Mchinji district. Rita is among 2,028 female-headed households who are benefiting from the social cash transfer scheme in our area. Rita falls under the labor-constrained group in the targeting of the ultra-poor for the scheme. She has 5 children and she also has a disability. She has been married twice, but on both occasions, the husbands left her with a total of 5 children who include 2 sets of twins.
I have 5 children, but I'm still single. This is because my first husband abandoned me while we had 3 children, and he remarried in Lilongwe. Then I also remarried, but unfortunately he had another wife. So he left me for his first wife while I was pregnant with twins.
The husbands left her with the heavy burden of fending for her 5 children without any support. Worse, with her disability, she has limited movement because if she does any heavy work, the leg hurts badly.
Food and clothing is scarce. In addition, I feel so much pain when I work for a long time. As you can see, I have a disability. If I walk long distances, my leg hurts so badly. Even if I do demanding chores, for example, when they were roofing this, I had to clear all glass. I felt so much pain, such that I have difficulties in walking. Even during the night, I sometimes have difficulties to visit the toilet because of the pain incurred.
It was because of the burden that she was carrying that the Community Social Protection Committee nominated her to be on the Social Cash Transfer Scheme.
We drafted Rita into the scheme upon realizing that she is faced with two major problems. Firstly, she is disabled. And secondly, she gave birth to two sets of twins, and thus caring for them is difficult as a single parent. So we felt by including her, we could ease her burden.
Rita therefore started receiving 2,600 kwacha from June 2006. With the money, Rita has been able to do several things that were impossible before she was on the scheme. Firstly, this was the house that she was living in with her children. But now she's managed to have a new house built, and she is now using the old one as a kitchen.
I started benefiting from the social cash transfer in June 2006. With the money I received, I built a new house for my family because my old house was extensively damaged. So I had to build a burnt brick house.
Additionally, she was able to buy government-subsidized fertilizer and managed to harvest enough maize. In fact, these two granaries behind her house is what she's managed to achieve. She also bought some chicken and a pig.
I bought 2 bags of fertilizer and used the money to employ labor for my farm. With this, I had a good harvest. I also bought 2 chickens, and luckily, they have multiplied, and today I have 6 chickens. I had also bought ducks and a pig. Luckily enough, the pig now has 5 piglets, and in total, I have 6 pigs.
But raising 5 children as a single parent is not an easy job. It is even worse if one has no steady income to meet the needs of the children, especially health needs. As can be seen from this child, he is malnourished. This was because he had a severe bout of malaria and was anemic because he was refusing to eat. Rita says with part of the money, she was able to take the child to a hospital some 10 kilometers away from her village, a thing she could not do before she was on the scheme.
As you can see, this child had been ill. So I used the cash transfer money to take him to Mchinji hospital, where he was put on a blood drip as he was anemic.
But the fear from many people has been that the money can easily be abused. However, the experience in Mchinji so far has been quite different.
What we have noted is that these people have always made good use of the money that we give them. So we have not had cases of money being misused or money used for something that is not intended for. Most of the households, after getting the money from us, what they do is that they go out, buy their necessities. For example, they will buy a bag of maize, buy salt, buy sugar, buy cooking oil to meet their daily needs in a month. And in some cases, we have seen these poor people actually investing in small businesses. For example, we have one family which invested in goats, and then we have one family which actually managed to buy bags of fertilizer. This is subsidized fertilizer. So you can actually see that they do not necessarily waste this money, but rather they use it for productive ventures.
It's not yet a challenge that we have observed, but an answer would be yes. I mean, you are talking about cash. People abuse things that are more complex. Cash is one of the easiest things to deal with, so it can easily be abused. But you're looking at people that are in their dire, poor environment and situations with a dire need, demand and quench for better life. So the chances that they will abuse an opportunity given to them to advance their lives.
Even at community level, they have watchdogs who ensure that beneficiaries are using the money for the intended purpose. The Community Social Protection Committee's work does not end at just identifying the scheme's beneficiaries, but ensuring that the money is wisely spent.
Our job entails that we visit every beneficiary, even though the area is too large. Our committee meets twice a week, so we get to know that such a beneficiary is using the money for drinking alcohol. It is easier to deal with them. After every meeting, we visit a zone and see how the beneficiaries of that particular zone have used their monthly allocation for. For every household, we get to ask if they are facing any problems as regards to the money. If maybe the husband and wife are not using the money together, we get to help in any possible way.
Even at assembly level, they have a mandate to investigate and even recommend removal of beneficiaries who are deemed to be abusing the money in any way, using what they call Form 6.
The committee members fill this form and gives it to the extension worker. And it's the duty of the extension worker to go to that household to investigate and verify if the information given by the committee members is true. If the extension worker finds that the information given is true, he signs to verify that the information given above is true, and it is sent to our office. And it's the duty of our office to send somebody again to that household to verify. If the information is true, that means that household is excluded.
But for Rita, this is a dream come true, and she has used the money wisely. She makes sure that when she gets the money, she does a proper budget so that she prioritizes her needs.
When I receive my monthly allocation, I plan for what to buy according to my family needs. I prioritize on what my household is lacking.
Rita says she is happy and is able to live a normal life where she can at least eat 3 times a day and send her children to school.
My life now has greatly improved for the better. The best part is that my children are now living happily. I can provide for food and clothes for the whole month. The children are also going to school without problems, and they are also working hard. The children are no longer malnourished, as food is now enough for the whole family.
She even has future plans so that she can be able to stand on her own.
If the social cash transfer scheme continues, I wish I could start my own business to supplement for the family income and that my children can have a better life. I also dream of being independent.
There are many who, like Rita, would want to eventually graduate from the scheme. Beneficiaries will be re-evaluated annually to determine their eligibility. Those who will have managed to generate income through innovative initiatives may be able to exit the scheme. This is Margaret Bikieri, 43, of Kachamba Village Traditional Authority Nyoka in Mchinji district, about 100 kilometers west of the capital city, Lilongwe. Today she is returning from a market about 2 kilometers from her village where she went to do business. Margaret is a mother of 4 and a widow. She lost her husband in 2001 to AIDS.
My husband passed away in 2001 with AIDS. It is unfortunate because at that time there were no ARVs to prolong his life.
It was not long that she too started getting ill so often. She was then advised to go to the hospital, where after a test she was told she also had the virus.
We went to Kamuzu Central Hospital in Lilongwe to get him tested for HIV, and he was found to be positive. My husband could not access ARVs because we were so poor to afford them at that time. This happened even though the doctors advised him to get into ARV treatment. In November 2001, after my husband had passed away, I became bedridden with different ailments. I then went to Kapiri Health Center where I tested HIV positive and was told to go to Mchinji District Hospital to get necessary counseling before I could get treatment.
Life then became tough for her. She had to ensure that she ate a balanced diet at all times in order for the ARVs she is taking to work effectively. This was not easy as she did not have a steady flow of income to buy food and other basic necessities. Worse, the hospital where she gets her ARVs is about 10 kilometers away from her village. This means she needs about 500 kwacha every month to allow her to go to the hospital. But now she's able not only to buy food but to travel to the hospital every month as well to get her life-saving drugs, thanks to the social cash transfer scheme. Margaret is among over 3,000 households who have been classified as ultra-poor in Mchinji and are benefiting from this scheme. She started receiving 2,000 kwacha from the scheme in June 2006. Targeting who is to benefit from the scheme is a basis for the success of the project. As already alluded to, the scheme aims at helping those who are extremely poor and cannot access the basic necessities of life. As such, a rigorous process follows to ensure that those who benefit indeed deserve to be on the scheme. Firstly in the process is the first Village Development Committee meeting.
It is at this committee meeting whereby the facilitators explain to the community. When we say the community, that means a VDC, Village Development Committee. The main aim, as I have already said, is to explain to the community the objectives of the scheme and the targeting criteria. So it is also at this first committee meeting whereby the Community-Social Protection Committee is elected. This is a subcommittee of Village Development Committee.
Once such meetings have been conducted and the committee elected, then comes the training.
This is a training to Community Social Protection Community Social Protection Committee. They are trained on how they can target the beneficiary households using the two criteria. These criteria are ultra-poor and labor constraint.
After the training, the committee then goes into the villages to identify beneficiaries with the help of their own communities. Once the beneficiaries have been identified, they are ranked.
Ranking is very important because it helps to have those who are very poor to be above, because the scheme targets only 10% of the total households in that VDC. In that VDC. So the main aim of this ranking is to have only those who are ultra poor to be on the forefront, so that when we say we reach a 10% cutoff, that means those who are ultra poor at least have already been approved.
The process does not end here. Even after ranking has been done, all Village Development Committee members within an area and other people meet at an open place where the names are further scrutinized. Here, for valid reasons raised by the people, some names can be removed and others added.
The ranking sheet is spread on an open space whereby everyone is able to see what the committee, Social Protection Committee, has done. The two aims of this second committee meeting. The first aim is for the committee to the community to verify that all the households identified by the Community Social Protection Committee indeed meet the criteria. The second thing is if the Social Community Protection Committee did not reach other households which meet the criteria, it's up to the community to say such a household was left out. But according to what we know, it meets the criteria.
Once this meeting has approved the names, they are submitted to the District Assembly for further scrutiny.
when they come here, the volunteers, it's also a discussion. We do not just accept the paperwork, but we also have a meeting with them. We go through all the households, again subject them to the criteria and verify that indeed what they have chosen or the number of people that they have chosen is actually the one that is meeting the requirement. So once this is done, then we say these people are now approved. We can now start giving them money.
So it is through that process that Margaret Bikiere found her household receiving the money every month end.
We nominated Mrs. Bikiele for the social cash transfer scheme on the basis that she is HIV positive and that she is a single mother caring for orphans in her household. Secondly, she was considered because she often gets ill and at such times she cannot ably work. It was for these factors that she qualified for the social cash transfer scheme. The scheme is very important because most of the beneficiaries are either HIV positive, the helpless elderly, or orphans. Most of these have benefited in several ways, like they have built houses, bought fertilizer and harvested enough maize, considering that before this scheme, many of these were so poor even to have enough harvest to last a year.
Since she started getting the money, a lot has changed in Margaret's life. She is now able to buy food and send her children to school.
Since I started getting this money, my life has improved in many ways. Since being tested positive, I was advised to eat well-balanced meals. As such, with the cash transfer scheme, I am able to get balanced diets as well as live a healthy life. And from the same money, I managed to purchase the subsidized fertilizer and hire labor for my little maize farm. I was able to harvest enough for my household. For this, I am very thankful to UNICEF for easing our burden.
Additionally, with the little money she saves every month, she has also started a small business, weaving baby clothes for sale. This, she says, supplements her monthly allocation.
My weavings also help me in so many ways. Most of my clients are women with newborn babies. I weave baby suits comprising a jersey, a pair of trousers, a heart, and socks. The whole baby suit goes at 350 kwacha.
More importantly, the money has also allowed her to have a steady supply of her ARVs. She says she is now able to travel the 10 kilometers to and from getting the drugs at the government hospital at Teboma.
Each month, when I get my allocation, I use 500 kwacha as transport money to the district hospitals to get ARVs. In order to get to the hospital, I use 2 buses, one from here to Kamwendo Trading Center, then another one from Kamwendo to Mchinji Central. Each bus fare is 100 kwacha. I use the same route back. Every month, I use 500 kwacha for transport.
Margaret is so lucky that at least her needs for now have been met. But the question remains, how long will the program run? How sustainable is it?
The government plans are to go beyond it being a pilot project because, as I have told you, the indications of it working very well as a program are very satisfying to us. So we want to roll out even beyond this stipulated period, because as you know, we are doing this together with UNICEF, and UNICEF is funding up to the end of 2008, if I'm not mistaken. But because of the success of the program, we want to go beyond 2008 and roll out in all districts. That is how serious government is.
Already there are other local partners supporting the program, including the National AIDS Commission.
We brought in our own support in terms of resources, such as financial resources, as well as technical support, to partner with the other players, the Minister of Women and Child Development, the Department of Disaster and Poverty Management, as well as UNICEF, to pilot this social cash transfer system in Mchinji.
As it is in the case of Margaret and many others in her situation, the scheme is their lifeline. It is no secret that the scheme has enabled her and others in her situation to live a life that was otherwise just an imagination.
At the meantime, my future plan is to build a new house because the roof of the house I am living in is damaged. And if I continue receiving my monthly allocation, I can manage to renovate the house. My priority for now is a new house.
A formal evaluation undertaken by the University of Boston in conjunction with the Center for Social Research is underway to assess the impact of the scheme. However, there are already indications that the scheme is bearing positive results.
The direct benefit is that you can see people are really moving out of poverty. They can dress properly. It means they have already fed themselves properly. You can only dress yourself properly if you are fed, your stomach is full. So they are also, going back to school for the children. They're going back to school because the money, enables them, to go back to school. That is direct. You can actually see this. Anybody can see that. Especially the communities there that saw the situation before cash transfer to these families, and then after. The impact is obvious.
To date, 3,094 households have benefited from the pilot scheme, reaching 14,332 beneficiaries. Of these, 9,734 are children, 7,686 are orphans, 2,018 are headed by elderly people, while 37 are children-headed households, and 2,028 are female-headed households. Across Africa and Malawi in particular, children are experiencing deepening poverty and mental stress from witnessing illnesses and eventual death of their loved ones. In most cases, these children are left to be taken care of by elderly people, most of whom cannot afford to provide the basic necessities such as food, education and health care. This is the case of Libesi, Geresomu, Chifundo and Mary. These children are orphans who have been left in the care of their grandparents, Kalinde and Selabia.
All these children are orphans. Their mothers passed away. Their fathers passed away too. The parents also succumbed to AIDS. We now care for these children.
In my household, I have 4 orphans under my care. My first son had 8 children, the second had 5, and the one who passed away last year had 7 children. In total, I have 20 grandchildren who are orphans. But lucky enough, 16 of them are under the care of some relatives, and I am left with these 4, 2 boys and 2 girls. These are the ones I am having difficulties with in caring for. The main problem is that we are too old, and hence it is difficult for us to provide them with all the basic needs like food and clothes. It is easier when we hire labor because the children are too young to work and look up to us who are too old to work as well.
Being old and taking care of 4 children can be stressful. These children have many needs to be satisfied in order for them to grow and become productive citizens. For the Kalindes, this has not been an easy task.
Before we were listed on the social cash transfer scheme, we were living a very difficult life with numerous problems. At that time, we had no assistance. But with this scheme, the burden we had has been eased. We live better lives now.
It was difficult for us to work and get income to assist the children. This was aggravated by our ages and the fact that our garden is not bigger enough for the family. But we always tried our best to provide the basic needs for the children. But with the assistance from the social cash transfer scheme, we managed to hire labor for the farm. We also bought the subsidized fertilizer and 2 goats. And with the fertilizer, we harvested 4 ox carts full of maize. I sincerely hope this year we will harvest yet another bumper yield.
But for now, their life has changed for the better since June 2006. The Kalindes are part of 2018 households in traditional authority Dambe in Mchinji on the social cash transfer scheme being piloted in the area. The Kalindes get 2,600 kwacha a month, a large chunk of which goes into funding for the 4 orphans.
From the scheme's money, I buy school materials for the children, the household necessities like soap and sugar, so the children have a bath and porridge before going to school. This I do because their school is a little far from here.
While the grandfather's approach is holistic, the grandmother's concern is always making sure that there is always enough food on the table for the children.
Whenever we get the money, firstly I buy all necessary foodstuffs for the home. I also use part of the money to mill maize flour. As we are old and the children are young, we also take part of the money and hire labor. With the same money, we were able to purchase 2 goats as an investment for the children to use in the future when we pass away.
The couple has also learned to manage their finances to ensure that besides food, the children have also some decent clothes to wear, both at home and at school. This means they have to save some money every month.
When we plan to buy clothes, we have to save for a few months for us to have the money. Even a 200 kwacha cannot buy enough clothes for a child these days. As such, in order to buy clothes for 1 child, we save 200 kwacha a month for at least 3 months, and then buy them with at least 600 kwacha cash.
Since most of the rural people depend on subsistence agriculture, the grandfather also felt it was necessary to save some money and buy the government-subsidized fertilizer. With the fertilizer applied to their field, the family managed to harvest enough maize than they have done in their entire life. They have also managed to buy 2 goats as an investment for the children.
From this money, I was able to harvest enough grain to last us a year. From the same money, I have also bought 2 goats as an investment for the future use to the children when we, their guardians, pass away. For this matter, I can foresee a better future for these orphans.
According to the District Commissioner from Mchinji, the Kalinde family is just an example of how appreciative most elderly-headed households are for the social cash transfer scheme. He says most of the grandparents do realize the importance of the scheme and have been using the money to improve the lives of orphans in their care by trying their best to do a little investment.
If they start investing, then what it means is that 2-3 years down the line, then definitely they will not be at the same point. So they will move to a higher level of economic activity, and therefore will not support them thereafter. So that is the aim of government.
While other quarters have concerns that the scheme may create dependency, the experience on the ground is proving otherwise.
You have to see what kind of households are targeted. A household which is headed by a grandmother, maybe 70 years old, with 2, 3, 4, 5 grandchildren who are too small for work, are already dependent. If nobody assists this household, people will starve. So it's not a matter of creating dependency, but it is meeting the needs of households who depend on social protection by whoever is able to provide social protection.
It is therefore interesting to see that despite the fact that the grandparents are still poor, they can at least give the basic necessities to the children in their care.
We see a great gain in self-confidence and self-esteem. What is very important in a country that's affected by HIV/AIDS, there are many children that are orphaned, and they often tend to grow up without love and being moved from one household to another. So this helps a grandmother to care for these children and to keep them. And now, since they don't need to struggle for survival, she can spend a bit of time with the children. And that is very important, so that they can tell their stories and they can be listened to and so on.
We have rejuvenated their goodwill to provide for their children. You know, if you go to Mchinji, you can see we are targeting these aged people. Now, these aged people, they are reviving what we used to see in early days, where all children would come to Agogo, where they would feast in Kute or Pala, and so forth. So, from nowhere, now this is what we can see. The values, extended values, which are known for Malawi culture, are being revived because for once the aged are able to provide. But where the aged cannot on themselves do that work, others are able to give them the support because the elderly has got food. What she hasn't got is the energy and the vigor. She needs a granary. She cannot construct, or he cannot construct. Now we see other people being able to do that on a fee. That, to us, elderly have been kind of rehabilitated. So to elderly, I want to use the word, it's a rehabilitation exercise.
And so with a little money, the Galindes have high hopes for their children. For starters, they want to build a bigger house that can comfortably house all of them, including their grandchildren.
At the meantime, our major concern is that we have no proper sleeping places. We are planning to use some money to mold bricks for building a much bigger house. The new house should have 3 bedrooms, 1 for the boys, 1 for the girls, and 1 for us. We will also have some more rooms for the goats and chickens. If this scheme continues, we will build a much better and bigger house with iron sheets. We can no longer have grass-thatched houses, as the children cannot cut grass, and we cannot hire labor for everything. But still more, our priority is to build a house and live comfortable lives.
The grandfather says they have saved some money to buy more fertilizer than last year, so that they should harvest more this year. They also want to buy a 3rd goat, which they will keep as an investment for the children.
Since we only bought 2 goats, we plan to buy 1 to add up to 3. All these plans are there to help these children in future when we die. When the goats reproduce, they may sell some and get some income for their daily needs.
So far, the partners involved are impressed with the outcomes from the project.
It is encouraging when you go into the household, this direct cash transfer. You find a household, the people who were destitute are able to support themselves. Indirectly, children are going to school now. Fine, so we are supporting the poverty alleviation indirectly. But to us is to make sure that we alleviate the suffering that has been caused because of HIV and AIDS. So you are seeing some benefits coming through. So we want independent people to evaluate this. Using the CBO, are we reaching the household with the same support? And using direct cash transfer through the assembly to the household, are we reaching the household? These are the questions we expect the media like yourselves to answer.
For UNICEF, it has been fascinating to see the impact of the scheme and to really tackle child poverty at the household level. And what for us is also important now is to help government build capacity, consolidate, sustain it, and to make sure that it can be linked to the health education services, so we really can document the gains against the MDGs on different fronts by supporting a cash transfer scheme. And we wish to confirm to our partners that we are committed to continue supporting it.
For the Kalinde's grandchildren and others in their situation, they can now afford to play and enjoy themselves, knowing there is a scheme that has their welfare at heart.